There's no one better to talk marketing than our moderator, Stacy Boothe. She's the founder and chief marketing officer for Savvy Marketer. Savvy Marketer Studio. With more than 12 years of experience in the medtech industry, Stacy brings a wealth of knowledge to support large and startup companies in launching new products. She's honed her skills in marketing strategies that drive results. With a master's degree in integrated strategic communications and expertise in content and digital marketing, she's a go-to in the field. She's also an adjunct professor helping to shape the minds of future marketing gurus. So Stacy, I'll turn it over to you and your panel.
Thank you so much. So first, oh, there they are. As I say, little technical detail here. So just trying to figure out the clicker, which is always fun in a new environment. But thank you so much, Kelvin. I'm so excited to be here. As Kelvin noted, I'm also an entrepreneur. Started my own company just recently called the Savvy Marketer Studio. We specialize in marketing strategy, which is a lot of what we're going to talk about today. So I'm excited to introduce our panel. In addition to their current roles, all of us have been in biotech for many years, and we'll just leave it at that. But we've worked in biotech, we've worked at big Fortune 500 organizations. Many of us are in startups now, and we have agency experience, we have direct-to-consumer experience, so we run the gamut when it comes to marketing. So I think you're going to get a really good variety when it comes to marketing. So right here next to me, Aimee Kilpack-Francis. She is the Director of Global Product Management from Scientia Vascular. I told her I would not get that wrong. We're really excited to have Aimee here. Next to her is Russ Bjorkland. Russ is the VP of Marketing and Strategy from Fluidx, right? Did I say that right? I don't know why the names of these companies are not phonetically accurate, but we're just going to go with it. Russ brings a lot of background both in marketing and in R&D. And then we have Kelly Himle, who is the head of marketing and strategy for Transit Scientific. So yeah, that one's easy. That one was obvious. So thank you, Kelly. And by the way, they do not make these chairs for people who are challenged vertically. So just forgive me here. I feel like a little kid with your legs swinging. So, all right. I'm not sure. Again, can you help? At the back?
Those guys.
Oh, back? Oh, that worked. Okay. All right. So we're going to go to our first question. So, what is the comprehensive role marketing plays in biotech from product ideation? This is like the marketing before people really believe that they need marketing. And we think about it as upstream. How many here know the difference between upstream and downstream or have heard those terms used before when it comes to marketing? Just a straw poll. Anybody raise their hand? Okay. So a fair amount, those of you who've worked with us at some companies, but good, fair amount. So Russ is a former engineer and somebody who's really focused on upstream right now in your company. Do you want to take this and share some information?
Yeah, I'll jump in and take that. So as Stacy mentioned, at the beginning of my career, I was in R&D, and early on, I thought marketing was a person down the hall that made the brochure. And since then, I've learned a little bit more about marketing and realized that it is a discipline, it's a mindset, and it needs to be an integral part of the whole product development process. So it needs to be, from the beginning, part of your mindset. I would say, as you start to develop and design a product, you need somebody that is looking out for the market that product is trying to serve. It doesn't need to be a marketing person, right? Some of us are in small companies where we're wearing a lot of hats. Some of us have whole divisions and that are focused on marketing. But all of us need to be thinking about this product that we're developing. It needs to mate with a market, right? So you've got people that are engineers that are focused on the specs, focused on making this product cool. You need somebody that you need a mindset that makes sure that we are looking at, does this product meet an unmet need, right? And so representing the market and making sure that that's weaving through all of design includes things like thinking about what we heard earlier today, like GPOs. We need to be mindful of, are there contracts? What is that going to look like? Whose unmet need am I addressing, right? Can I get to that person? Am I making something that actually is solving a problem? So upstream, I think, is a lot about looking at the market and collecting those design inputs, making sure that it's not just that I'm making something that's really cool, but that I'm uncovering an unmet need. And a lot of the way we do that is through market research, right? So, talking with physicians, clinicians. I'm in the med device space, so we're doing a lot of interviews to uncover unmet needs. But I think even more important than that is observing, right? So you'll have physicians that say, "Oh, I've never had a problem with that," right? "Oh no, that doesn't ever happen to me." But if you can go out and watch procedures, and especially, a lot of these physicians and clinicians they're MacGyvers, they're problem solvers, and so they'll figure out a way to make something work, and they don't think it's a problem. But if you watch it, you realize, oh, if we just did this small tweak to our product, all of a sudden they don't have to do all these extra steps to make it work, right? So observing, I think, is a very important part. And that's part of understanding the market. That's marketing, even if you didn't know that was marketing.
I think what Russ says is so important because, we had this pediatric group up here earlier, and they actually showed a chart with the phase gate exits on it. And I wanted to raise my hand and say, hey, quick note, because what they had is they had each of the phases. So, you're essentially sort of moving from your concept through your design, your validation, verification. And then at the end, they had commercialization and marketing. This was positioned as one of the last things that the organization should be thinking about. And I would challenge you to think differently about that. We should be thinking about commercialization, as Russ is saying, very far upstream. We should be thinking about that in the beginning. And for some companies, that's going to be hard. In the last group, there was a company that really only focused on the very upstream part of product development. They were actually never going to bring a product to market. But again, if you've ever had to create a pro forma for an investor or for a merger and acquisition, it's critical that story around who we're going to serve, how we're going to serve them, is defined. Got it, at the very onset. So I think that's a different way that we have to think about marketing. If you're in an organization that thinks marketing is just the brochure makers down the hall, you're really limiting your perspective on what a marketer can do for you and how they can broaden your strategic thinking and also drive discipline in your organization. In my company that I'm working at now, one thing we found is they are so good at collecting inputs and they were so good at ethnography. But the problem with what we were seeing organizationally is that this knowledge became so tribal. It was held with a few select engineers, and there was no documentation around the data that had been collected. And then another thing that we saw with these inputs is we weren't really analyzing for trend. So we'd have one or two doctors say, hey, I think we need to make this amendment to the design. And then a week later, we'd have two doctors who would say something different. And so incorporating marketing early is valuable in that it can help you define and look for trend so that you're not doing this sort of knee-jerk turn, redirect. Because when resources are finite, as we know they all are, I mean, this is a very hard market, Stace, right? Like, this is very challenging. We want to be very thoughtful about where we're applying those dollars, and marketing can help apply that strategic direction from the onset.
Yeah, and I think that leads into one of the things I'm passionate about as a marketer. I'm more of a downstream marketer, but in my experience, I'm much more focused on upstream now. And the reason is everyone in here is in med tech, so you know how regulated it is. And the point I want to make with that is marketing is too, right? You can't just go and say that you have the best device that's going to save lives without having data behind it, right? And so to their point, when you're thinking about this really early, you've got engineers that are working on a great product, But as a marketer, you need, or from a marketing perspective, it doesn't even need to be a marketer, you need to think about what you want to be able to say and claim about that product very early on so that you can gather that data. So when your engineers are doing their 510K testing, you can say, hey, can we also test our competitors so we have that data and we can say we're superior, right? Without that data, you can't say that. And you know, I've had experience, I've worked for a really small company now, and the more we can collaborate and the more I can kind of piggyback off what my engineers are doing, the better, because then we're not having to pull extra units for commercialization testing down the road. We're not having to take my engineers away from what they want to be doing to get me some marketing claims, right? And so the more I can collaborate with them very early on, I'm getting the data that I need that I can then use down the line. And I've been in the other situation where you don't do that and you either are really frustrated and you have marketing material that's just basically a list of features, like this is what my product is, and you know it's really hard to get people to care, or you're having to go back and do that testing and it takes a lot of money and resources and people are frustrated and it's just not a good situation. So I think, you know, when you're in product development, the more you can think about, you know, the unmet needs that this product is going to serve and what you want to be able to say and brag about early on so that you can actually do that when you're commercializing.
Can I give an example? Is that all right?
There's countless, I'm sure.
There's a lot of names for it, but there's a process that you can do. You put together what's called a claims matrix, what we might call a claims matrix, right? Where you early on start to list all the things you hope to be able to say about your product, right? And then you make that list, and then you go down and you sit down with the development team and say, okay, what tests do we need to do to be able to make these claims, and figure that out up front, right? So that you can save time, save money by weaving it into the process early. We just went through that process with one of our products, which is about to go, well, this week went into the FDA for an IDE, right? So we're hoping to start a clinical trial here in the next couple months. And so we did this claims matrix process, and we identified some things that we'd like to say that we weren't going to be able to say. So we were able to make a couple of changes to some questions that we had in a questionnaire to the clinicians that were going to be using our product that will, on the back end, allow us to say some pretty strong claims if it works out the way we hope it will. But had we not done that rigor, done that process early, you know, we would have gone through this whole clinical trial, come out on the back end in a year and a half, and been hampered by our inability to say some things that we really know we'll be able to accomplish. So the rigor of doing a claims matrix early made it so that hopefully in the end we'll be able to say some cool things.
Do you guys know how many here have heard of a claims matrix before or have used them? I mean, it's really starts as a spreadsheet and then kind of grows. And a really good way to start that if you're kind of confused, the really important thing, I'm sure there's things in your business case that you've identified that you need to be able to say, but know who your ideal customer is. And you do this potentially more than once. You do it in testing, and then you do it later on what can we actually say, what came out of our test. But you need to know who your ideal customer profile is. You need to think about what matters, not just what the shiny object does, but what do they care about and why do they care about? What are those higher level emotional benefits? So don't get really caught up in the features and the, you know, it delivers this and it has this speed and it has 2 lumens and whatever. Yeah, that's all great. It all validates it. But get to that higher level emotional benefit of why do they care? What does it do for their patient? What does it do for their efficiency? How does it make them better at their jobs? And that'll help you also be able to build your claims matrices.
Stace, I want to add to that because Russ told us about this, what he actually did, and it was quite clever. So he mentioned that when they were developing these endpoints and the actual surveys that the clinicians were going to ask or respond to after they participated with the device, what they were originally doing is they had a Likert scale. And on the Likert scale, they were asking them to rate the performance. And the marketers were clever in that they said, hey, I think this Likert scale isn't doing us the justice that we want to see in this final claims matrix or in our final collaterals. And so, Russ, maybe you could talk a little bit more about the word choice, because I thought it was so clever what they did. I want everybody to hear.
Okay, thanks. Yeah, so, we asked the clinician a couple of questions about, was this acceptable? And then when we did our claims matrix, we realized that we actually wanted to compare against what they were used to using and ask some questions about, is it better than what you have been using? And so we put that together, and the way that we framed it originally was the options were, let's see, far worse, worse, equivalent, better, far better. And that's awesome. But as we were reviewing, what do we really want to say, we realized better isn't very strong. And so, and this is just on the survey that we have to submit, and it has to go through the process. We changed better to superior. So instead of equivalent, better, far better, it's equivalent, superior, far superior. And just that little word change, right, makes for much more powerful marketing in the end. So, oh, great, that's awesome, your product's better. But superior is stronger, right? So just those small things can give you a lot more to work with on the back end.
I think, Kelly, we wanted to talk about an experience you had regarding collaboration. I know you said your passion is claims, and you've done a lot of them that then lead to the messages. But I know, you were working on a device that was requiring some collaboration, and you kind of had a light bulb moment for someone that you were working with.
I did. I can't stress enough the collaboration key on this. Marketing can't do this alone. R&D can't do this alone. Regulatory sure won't do it. So collaboration is key. And this was back when I was working at BD, and I thought I had all the pieces right. We had a weekly meeting set up where we had everybody represented. We had a product manager, we had regulatory, we had the R&D engineer who came up with this awesome device. We had medical, we had everybody in the room. We had a weekly scheduled call. I thought I had all the pieces in place, and we'd go into the room and we'd talk about what we wanted to say. And I noticed that the engineer sat in the corner, kind of arms crossed, didn't say a lot. And so I approached him after the meeting and I said, what's going on? This is fun, this is great. And he said, this is a waste of my time. What am I doing here? I'm not building things, right? And he kind of had an aha moment when I said, everybody in this room knows how cool your device is, but if you want other people to know about this, if you want this to actually be implemented and helping patients, you have to help me talk about it, right? And get it to the right people. And after that, it was so fun because it was like him bragging about his device and telling us how we could test to prove this so we could say this. And it was just a really great experience that resulted in some really great marketing at the end during commercialization.
Yeah, marketing really does become kind of that hub to the spoke of everything that's going on. And I know all of us have had definite experience in making sure that you're thinking and collaborating really early. And that's kind of that transition from upstream to downstream too. It's not a handoff. It's like, oh, okay, here, commercialization team, we're just gonna hand it to you and away you're gonna go, good luck. No, everybody should be involved in the whole process. And anytime from the beginning, all of the conversations and the things that have gone on and why it matters and why you care about it and why everybody cares about it makes it so much easier for everybody to get behind it and achieve that actual true business objective and the benefits and things you're trying to go to. So with that, we will transition to commercialization. And I want to start first with a discussion about when does commercialization really start? And Russ, do you have some thoughts on that?
Yeah, I do. Yeah, so we've already talked about it quite a bit already, right? That you need to be thinking about the market that you're serving at the very beginning of the project. But we kind of talk about upstream versus downstream. In my mind, and there's a lot of ways to look at this, but I feel like when you're doing the upstream work, you are collecting inputs. You're getting information to help inform the product, understanding who are the customers, who are the people that are benefiting from your product, how are they benefiting, What are the market dynamics? Are they changing, right? So you're collecting inputs, and then I kind of feel like at design freeze is where now you've frozen the design, you know what you have to work with, you need to start kind of pivoting and starting to look down the stream at, okay, I know what I've got, now how am I going to communicate what I have to the people that care about it? Who are the people that care about it? What are the ways I'm going to commercialize this, right? So that's kind of how I see that pivot from upstream to downstream. I'm sure there are a lot of different ways that you could look at it, but
Yeah, Aimee, do you have any differentiation in that?
Yeah, I think we think about a lot when we're doing this go-to-market strategy, as it's called. And Russ touched a little bit about audience, right? Who are we talking to? What are we talking to them about? And this is important, but I think there's always a way for us to go deeper with our targeting. And this is one of the areas, again, where marketing can create value organizationally. I think it's very easy to say, we're going to target this physician. But very often within physician groups, or even different clinical or clinician groups, there are different types of users. And I think it's very important to define personas and behavioral patterns and practice patterns for each of those types of clinicians. So what do I really mean by that, Stace? What I mean by that is, within a user group, for example, you may have tenured physicians that have been practicing for 10 years, 20 years. Perhaps they're quite slow to adopt. And you may need a different plan for them, right? You may need to do something entirely different for people that have different levels of experience. They talked a little bit about this in some of the other sessions, that we know that physicians, clinicians who are newer to practice are very often more likely to pick up and adopt newer technology. So in your go-to-market strategy, the questions that we should be begging are, how are we addressing these different targets, these different groups? And even within that, we can further segment. Do we have early adopter behavior patterns? Do we have late adopter behavior patterns? Do we have patterns of risk aversion? That sort of weaves into that as well. And so we should be very thoughtful about this. And this is one of the places where I think we just skim over. Hey, I'm in neurointerventional, we're going to serve neurointerventionalists, easy. But it's not easy, it's quite complex, and if you spend the time doing the work, you can create a go-to-market strategy that's phased in its approach, right? It's not looking at a singular user, it's subcategorizing those and creating really strategic plans to attack that different group, those
And
different
your
groups.
CFO will thank you because that you will actually have a purchase strategy that aligns with your marketing strategy, and when the market takes off slowly, you will understand completely why. Kind of going a little further in that segment or that persona development, Russ, you need to think about your ideal customer persona. And I know you had an experience where you had an ideal target, but it wasn't the buyer or the user. And so maybe you want to share that story a little bit about how you overcame that.
Yeah. And so medical device is tricky because the payer isn't always the one that's using your device, or the one that's putting in the device isn't the one that sees the benefit. And I have an example of that a little bit. There was a dialysis catheter that has amazing flow characteristics. It's makes the dialysis nurse's life much better. So in dialysis, right, the patient's getting their blood cleaned, and if there's any kind of issues, the dialysis machine starts to go off and all these alarms go off, and it causes a lot of stress for the nurses. So this dialysis catheter that we had on the market solved a lot of problems for the dialysis nurse. But the dialysis nurse wasn't the one that puts it in. So they weren't the one that decided what product to use. And so, and interventional radiologists and nephrologists, they were the ones that decided what catheter to use. And so we had to figure out, how do we make them care about it, right? They're like, well, we just go with the cheapest one or the one that's easiest to put in, right? So understanding who the purchaser is may be different than the people that you're benefiting. And so you need to figure out, how do we message, how do we connect them, right? So we developed tools for our Salesforce to connect the dialysis nurses and the interventional radiologists, so that they were able to communicate, oh my gosh, I didn't realize you were having so many problems. Well, yeah, of course, I'm happy to try this catheter, and if that'll solve your problem. And also helping the placers realize, okay, so if I solve the problem for the nurse, then the nurse isn't calling me to come down and solve, and troubleshoot at 2 a.m. or whatever. So helping the placer recognize the benefits. So I think that's important, is just understanding, okay, who is it that's actually benefiting? They are the ones that I need to make my champion. And how do I help them to connect with the people that are making the decisions, right? So you're not always going to be able to get to the C-suite. They're very busy. They have a lot of other demands on their time. So if you can find somebody that really wants to be your champion, in this case it was dialysis nurses, then they helped move things along for the purchasers and the deciders that were up the chain, I guess.
Great, and you want again, like we talked about, you want your claims, your benefits, your messaging all to fall in line with those correct audiences, because they're going to be different messages that appeal to those. So you alluded to getting your Salesforce and helping you connect. And so having a channel strategy, a sales channel strategy, is really important, because if there's nobody to sell your product, whatever that may look like, or it's not on contract, it's not actually going to go anywhere. It's not going to leave your warehouse. So Aimee, you've got a lot of experience with that area. Do you want to kind of share some of your experience there?
Depending what your business looks like. So depending on what your business looks like, you may already have an established sales force. If you are a younger company, a startup, you may be acquiring a sales force, hiring talent, getting people in the pool, and you're coming up with this go-to-market strategy, and the commercialization plan is going to be integral into that. But the challenge I think we have with sales in med device is that it's unusual in how relational it is. So if we think about some of these other markets where it's much more customer focused, so we're selling direct to the customer, it's interesting in med device that we can leverage digital channels, and I think digital transformation is important, but I would honestly argue that med device is probably 10 years behind in the digital world. And so you don't want to minimize the importance of your sales force and generating sales enablement tools for them. I think this often gets overlooked. We hire sales folks, we give them a couple brochures, and we send them out into the world. But as part of your go-to-market strategy, we need to really consider what it is that they're going to need to be successful. In Russ's case, he's finding out that, hey, the nurses and the doctors don't talk. And so the question that we should beg in that instance is, what tool does the sales rep need? Because the marketer's not going to be face-to-face with the doc and nurse every day. We're usually in the office, we're still gathering inputs, we may be working on other upstream things. So your rep is now the hands representing the company. What tools are we going to give them so that they can successfully connect those partners who are eventually going to be purchasing partners? So I think this is really an important thing for us to, again, consider, this idea of not just, oh, I'm hiring a sales force, or no, I'm not just staffed with a sales force, but what have I given them to be successful? And sometimes you have to get really creative with this. They're going to be facing value analysis committees. That is getting much more difficult with time to get your product into a hospital. Are they going to need health economics data? One of the things that we've actually had to create, and I've seen this in multiple organizations now, is value analysis packets, where the rep is not allowed to go into the value analysis committee. And so instead, what we create as marketers is a sales deck and a sales training that we can hand off to a physician, and they can go in and argue the case for the product. So have we made those things? Are those things ready as part of our commercialization and go-to-market strategy?
Maybe you could talk a little bit about kind of the customer journey, right? So the sales force is important. At some points, you also kind of need to be thinking about, upstream of, before they're even connecting with the sales force, are we touching that customer in the right way, right? How are they finding out first about the product, or, where do they have a problem? Where do they go first for information? So that can be the sales force. It can be, literature. There are a lot of ways, right?
Yeah, I think that's a perfect segue into Kelly and talking about our communication strategy. But the other thing to think about with sales channels is, do you need to use a distributor? Who is your distributor? Does your distributor have promotional campaigns running? Can you get on those promotional campaigns? What are all of the things that the distributor needs? What kind of data, what kind of information, what stats, what specifics, what pictures, what's everything that they're going to put into their database place to help their sales force, like a Henry Schein or whatever, go out and sell your product. So it is bigger than just your own sales force. You've got to think about every channel, the percentage of sales that come out of each one of those channels. Do I need to be on contract? I know we had a great session before on GPOs. Do I have to get that on contract? What is my marketer going to deliver to help me get that on contract? What's everything in that contract negotiation or that contract discussion? Are they going to do an event? Do we need to have a table? Are we going to talk about things? So really, it's really, really, really important to think about that channel strategy and also your marketing strategy. So this is kind of that part that you think of what marketers do, but it is more than just a brochure, as Kelly will talk about, and it is really tied to that customer journey.
Yeah, I think as a downstream marketer, I've heard so many times where I've got a product manager who's ready to launch a product, and they come and they're like, I need a brochure and I need a website. And it's understandable. Like, I think Russ talked about that at the beginning, right? Like, you know you need those things, and yes, you probably do. But I think it's really important, especially in today's digital world, to really think strategically about how you're going to implement marketing. And the marketers in the room will know this inside and out, but I wanted to kind of touch on this for people that aren't marketers, but that should be thinking about this or understanding this, in that really kind of the go-to strategy for marketers is the GHOST strategy, which is goals, objectives, strategies, and tactics. And so goal obviously is just your kind of your North Star as a business, right? What are you trying to do? What difference are you trying to make with this product or with your company even? So just that's going to keep you honest. It's going to keep you motivated. But then we're going to get into the meat of it with the objectives. So you need something to be measurable. So this is going to help you get budget for marketing that you need desperately. But also it's just going to make sure that you can check in and see the money you're spending and the things you're doing and the energy and resources you're using are actually doing something. They're moving the needle. And so you really need those measurable objectives. Strategies are how you make those objectives happen, right? So I guess I should start with an example, but objective would be something really measurable, like we want to increase awareness by 20% in our top 25 accounts of nephrology, or something very measurable, very detailed that you can track. But then those strategies are how you're going to do that. So you want to raise awareness, you might do a webinar, right? So you do a webinar that's going to teach them why your product is going to change their practice and save lives. But then you get into the tactics, which I think people often just jump to those tactics, like the brochure. But the tactics really should be how to make the strategies happen. So it's like the invites, it's the landing page, it's the follow-up campaign. It's all of that actually is going to make that work and get people to go there to change their behavior or to increase their awareness. And so it's really important that you have all of those pieces and have a plan that you can stick to and be consistent, because I think it's really easy as a marketer. Sometimes my CEO will step in and say, like, hey, did you see that our competitor has this great glossy ad in a journal? And I was like, yeah, it looks great, but do we really want to spend $20,000 on this without, like a support campaign or a follow-up campaign? And it's important to gauge your competitors, but you also have to be true to what you need and what you're trying to do, and not just kind of follow whatever's shiny. And I think that's marketing a lot. It's like, it looks cool, it's flashy, but really, what are you trying to do? And you really, you need to make marketing measurable, and you need to make it matter, and you need to make it work for you. And the only way to do that is to have a plan and to stick to it.
I think we run into that so much with budget, right? Because there's always a CFO who goes, what's the return on investment? Tell me how that's going to move the needle, right? There's a myriad of terms you'll get challenged with. And it's difficult. It's difficult if you're chasing the competitor in one-off touches that aren't aligned with the customer journey. Because the traceability of ROI becomes so challenging to follow. You've spent $20,000 on an ad in a journal. How do you measure impact? Did you see the individuals read and look at that and then purchase and buy, right? You start to lose track of the customer when you start to lose track of the strategy, and that will always make it really almost inextricable to pull those KPIs from that data, because there's none.
Yeah, no, that's perfect. Plan, do, review. So you have to have everything be measurable. You have to have your KPIs. So your KPIs are your key performance indicators. tie them back to the business, tie them back to what your CEO cares about. If you are the CEO, tie them back to what your board cares about. When you report on this, when you report on an initiative, you need to be able to tie back every effort, every dollar spent in some way to that initiative. And it's also a really good way to say, oh, do we need a pivot? I worked on a COVID-19 testing product, and they were seeing that they were getting tons of eyeballs through Facebook, and they were so excited. Not one of them went to our website, not one of them went to Amazon, not one of them converted. They were seeing that emails were actually driving conversions. So they were able to track what channels were actually driving sales, and the important thing was to have that plan. So they knew they went from Facebook to a landing page to a website to maybe a sales rep, or in Kelly's example, a webinar. They knew that they went from a landing page to register, they got 2 or 3 more emails, then they attended or didn't attend, so they went in different pathways, then they had different emails, and then eventually they became what we call a marketing qualified lead that would then go to your Salesforce, so then they could go out and say, hey, I saw that you attended this webinar, I want to have a conversation with you. So there is really a science, but you can't do it unless you know what you're tracking, what you're measuring, and you have a very detailed pathway to get there. So, keep that in mind. And with that, I think we'll just have a few closing thoughts. So Aimee, do you want to kind of wrap us up here?
I guess. I want to talk about MQLs more. I think MQLs are so fascinating because what you can do with an MQL to marketing qualified lead, right? So you've done all this work, you've done your ghost, you've done all your go-to-market, and now you're starting to say, okay, what's happening with these potential customers? And what I love about MQLs is that there are so many data points that you can pull from an MQL. So what we really like to look at with MQLs, and I would encourage all of you to do this, is, okay, we have an MQL, did we reduce time to conversion? If marketing did their job, we reduced time to conversion. So maybe in the case of med device, it's, you know what, we reduced time in value analysis committee because we qualified all of those key stakeholders before that rep went in there or before that champion went in there. So MQLs, they're smart. If you're not measuring your qualified leads and attributing them back to you as a marketer, do it, because you get to take credit for really great things and people will like it. So I will harp on MQLs for a minute. But what I would really encourage you guys to take away from this is, depending on the size of your company, you may be new to the world of med tech, or you may be a long-standing friend of med tech and have been here a while. I think what I see a lot of times organizationally is we respect all the disciplines in our field. We respect engineering, we respect regulatory, we respect quality. But what I tend to see, and I feel bad saying this because you're all great people. Everybody, you deserve better. But what I tend to see happen, and this is quite frank, is we don't always value marketing. And I think part of the reason for that is that we've all been marketed to. In our lives, we are constantly inundated with marketing efforts. And so I think as a reflection of that, all of us perceive that we know how to market. And it's very easy for CEOs, executives, cross-functional stakeholders to say, I know what I'm doing and I've got this. But what I would like to see happen is a respect for the discipline of marketing, for the science of marketing. It is challenging. And when you look at the breadth of what we've covered, upstream, downstream, sales channel, go-to-market, ghost, there's all of these tools. To have the breadth and experience to cover that is challenging. And I understand that it's challenging. I understand that it can be perplexing. But I would encourage everybody to look at, are we spreading our resources too thin? Are we making engineering wear too many hats, regulatory wear too many hats? Because we don't want to maybe make the commitment to spend on marketing. Or is it that we perhaps perceive, as we saw in that pediatric session earlier, that I don't even need to bring commercialization into the fold until 5, 6, 7 steps later? And I would challenge that. I would ask us to think differently about that. I would ask us to consider the impact of marketing at the forefront and at the early onset of business decisions. You can see that it can help you set your strategy and not only have it considered as a discipline, right, marketing as the science of marketing, but to help discipline your organization, to to march you to true norths, to march you to things that are measurable. I think that's really important.
Yeah, I just to say it needs to be part of the design, right? You need to make sure that you're designing for the market, right? If you're just designing because you've got a cool technology, but the market's not ready for it, then it's not going to be successful. And so whether it's a marketing person or it's somebody just thinking through and representing the market in the design, you need to make sure up front that the design is meeting the market need, and it has to mate up, or else it's not going to be successful.
Yeah, and I think I want to go back to a point I made earlier about you could have the greatest device ever designed, but if people don't know about it, it won't reach its potential and your business won't be successful. So I just can't stress enough of just taking marketing seriously and thinking about it and collaborating with your marketer if you're not a marketer, and just seeing the value that they can bring if you help and if you collaborate with them.
And we left some checklists on the edge of the table if anybody wants to take them. They're marketing checklists to kind of help you walk through the process that we did. And also keep in mind, you don't have to hire a full-time marketer. We've been blessed enough to work for companies that hired full-time marketers, but you can bring in part-time consultants, fractional people, someone who can help you do the things that they're really good at the stage that you're ready for. So it doesn't have to be a full investment in a full-time person. So keep that in mind too. I want to leave you with a stat. According to a 2022 report by Startup Health, 70 to 90% of startup medtech companies fail within the first 3 years of business. And there's a lot of reasons for that, but part of that is because there's a lack of experience or a lack of breadth of experience by the founders or by the executive team in knowing all of the disciplines and being able to really bring that product to market. And you improve patients' lives. You do really good things. Don't let your product or your effort fail because you've decided to invest too late in something that's really going to change the course or direction of whether or not you can be successful. So thank you so much. Kelvin, do we have time for questions from the audience, or do we just want to kind of let people go home?
Probably don't. They can talk to you right after, but don't you just love the way this expert panel makes everything seem so simple and so logical? I just listen to this and go, yeah, that makes sense. That's so logical. That makes so much sense. And then I think, how do we implement that? So thank you very much. You did a great job.
Can you turn the music back on? Let's leave with a little energy.
Guys.
No? Okay.
That's great. And please, we thank our sponsor, Mattia Mobility, and Mayor Brown. And if you are not members of BioUtah, please come see me. We want to have you as part of the team. Thank you all for being here. This concludes our conference.